Hello, everyone. My name is Kay Gooch, and I'm Director of Community Programs here at ARC. And I'd like to welcome you today to our webinar on caring for the caregiver in honor of National Caregivers Month. For just a little background on ARC, ARC is a patient-focused, patient-founded nonprofit organization whose mission is to advance science to improve and extend the lives of those with amyloidosis. And then just a little bit on our focus. We focus on improving the speed and accuracy of diagnosis, which is so very important, increasing our understanding of the disease to identify new treatments. We want to accelerate approval and reimbursement of effective treatments and enhance the quality and the care for people living with amyloidosis and their caregivers. I'd also like to thank our sponsors who they're very generous, who have supported our webinar series. And then just a little thing kind of hot off the presses, ARC is opening its community survey today to get input from patients and caregivers on what it's like to live with this disease. There will be a survey both for patients and one for caregivers. So you can scan the QR code or you can go directly to the link to participate. And just as a reminder, these slides will be posted on our website, so you can see the slides and get the QR code once and be able to get to the link in that way. Also, at the end of the webinar, you'll get a survey from us, and we would really appreciate it if you would take time to fill that survey out. Your feedback is very helpful and helps us plan more for our webinar series. And then lastly, please add your comments in the Q&A box as you think of them throughout the webinar, and we will have time at the end to answer your questions. So that I'm going to go ahead and move forward with introducing today's speakers. I'd like to welcome Debra Ruehlman and Ann Payne. Deb's husband, Peter, was diagnosed with AL amyloidosis in March of 2018. In 2021, he had a stem cell transplant at the Mayo Clinic in Minnesota and is now back on chemo with a host of other complications. As a now retired oncologist, Dr. Peter knows his disease and what can lie ahead. Deb is a retired film and television producer whose retirement life changed dramatically with this diagnosis. They live in Cincinnati and have adult children who live in Boston and New York. And Ann Payne, some of you may be familiar with Ann because she's the voice on the phone if you call. Ann is ARC's Manager of Clinical Care and Education. She holds a master's in social work from Smith College and has worked with nonprofits for over 20 years. Ann has clinical experience in supporting patients and families living with amyloidosis, multiple sclerosis, liver transplant, and cystic fibrosis. Prior to joining ARC, Ann developed and managed a peer mentoring program for people with CF and their caregivers. Ann's very passionate about the patient and family empowerment and enjoys engaging with patients throughout their journey. So without any further ado, I'm going to go ahead and I'll go off camera and turn it over to Ann and Deb.
Great. Thanks so much, Kay. We're so pleased to be here to celebrate National Family Caregivers Month. I'm glad that there's a month to shine the light on this issue in our society, but also we really need to be thinking about this every day, not just in November, but we're thrilled to be talking about it today. There are 53 million adults in the US who care for their spouse or their elderly parent or relative, or their child or adult child with a disability. And that is a lot of people, and it translates into billions of hours given and billions of dollars spent on unpaid work in our society. So it's really a very important issue. The good news is that that means you're not alone. There's lots of other people out there who are going through this and other people who understand what you're going through. And there are supports and services that exist to help you. So moving along, we have a beautiful picture of Debra and her husband, Peter. And Deb, do you want to just share a little bit about yourselves?
Yeah. First off, I'm not an expert on caregiving or anything medical. You heard our bios. My husband's the medical one, and he calls himself the triple threat because he has amyloidosis. Has in his past taken care of people with amyloidosis, and he's involved with the consortium as well and other things. But he had to stop working immediately after the diagnosis, and we've been at it now for about 6 years. Um, it's definitely a partnership.
So Deb, you shared with me a little bit about what it felt like to get the diagnosis. Okay, the next slide just gives Deb's words about the diagnosis: shock, fear, a new world of learning about the disease, and it will be different for everyone. So that's important to remember. And Deb said that you're in for a marathon, not a sprint, and you don't know how long this race will be. So Deb, could you just sort of share kind of some of your feelings that you and Peter had when you first found out that this was going to be your life?
Well, the first thing is I had no idea what amyloidosis was. Because my husband's an oncologist, I hear a lot of different things, but I'd never heard this one. I talked to a friend who said amyloidosis. Oh yeah, that's on television, those medical series when they don't know what anything else and they want it to sound really bad. They say, "Oh, he's got amyloidosis." And that's pretty much all I knew about it. But the hard thing is to learn that there's no light at the end of this tunnel. And I don't mean to be, downer Debbie or anything, but there is no cure. And we have to do what we can right now to live the best life that we can. And that's different for everybody. It's different for me. It's different for my husband. But it's something that there are too many unknowns. You don't know where it's going to end. You don't know what the journey is going to look like, and you don't know how you fit in. We're learning every day.
Absolutely. Thank you for sharing that. We are going to be covering some different aspects of caregiving today: practical aspects, medical ones, some legal and financial info, and then the all-important emotional aspects of caregiving. So we'll just kind of go through each one and share some ideas about them. And just a reminder, these slides will be available. So some of the links and resources and tips that we've written up here, you can access later. So let's dive into our first topic, which is practical aspects of caregiving. And really the main takeaway is you can't do it alone. You have got to have some help. So, Deb, let's launch into how to ask for that help. There's some different things to think about in that respect. Okay, you can move on the slides.
The first thing that I had to learn is that it's okay to ask for help. People really do want to help. They want to do something. And I know many people that say, "Oh, I don't want to burden my friends with it." But when you help people do something for you or allow them to do something for you, it makes them feel good too. And I had to learn that. So who did I start asking? Of course, family and friends, religious and community groups. We are connected to a church that has been just fabulous. There's professional help all over the place, some free, some you have to pay for, some covered by insurance, but there's a lot of it out there. One of the things that I first learned was I have to be direct and specific. It's just like when people say, "Oh, how can I help?" I like when people say, "Okay, I'm bringing you dinner," or "I'm going to come do your laundry," or "I'm going to the grocery store, give me your list." And that's when people are asking, but I can be the one to say, "Wow, I really need a day off. I really need 2 hours to myself. Would you come stay with me?" Or I really need um, not just something at the grocery store, but specific things or things even around the house. I need somebody to help me in the yard. There are a lot of websites out there that I've used, and in a minute we'll talk about some of those resources, but they were great because then people who had asked for help had specific tasks that they could do, and I used them. So what are some of the things? Meals and groceries. Now, meals and groceries, you think, okay, that's easy. That's a no-brainer. The big thing I'd like to share with you here, though, is when people say, oh, we'd like to bring you a meal, invite them to come in and eat it with you. Because sometimes you and your loved one might feel isolated. And for somebody just to drop off a meal, what you want is companionship. You want people to come in and be with you. Now, not all the time. Sometimes you don't want company. You want to be by yourself. But don't be afraid to say, oh, please bring our meal and stay with us. And you have to be honest. I'm sorry, equipment and supplies. Oh my gosh, this has been great. Put the word out that you need a walker, you might have them. Put the word out that you need crutches or a shower seat or this or that or anything. I'm amazed at how many people have things and they're happy to give them to you. Transportation is a big one because I can drive, but there are times when I don't need to be there and I just want to get something done at home. And if somebody else can take my husband to that test or whatever he has to do, that's really great. Regularly scheduled visits are kind of nice to be able to look forward to. I talked to a friend who's a caregiver for her husband, and she said, we look forward to every Wednesday morning when his sister comes over for coffee. Simple. She comes for coffee every Wednesday. But my loved one knows that on Wednesday morning she'll be there. Now, if something comes up, of course she wouldn't come, but that's just to be expected. Outings are a big thing. Now, when I mean outing, I don't mean anything big and exciting. I mean, hey, I'm going to the hardware store. Do you think your husband wants to come along with me? That's an outing. Or just taking a drive or doing it for me, saying, I'm going to, let's go look at a museum or just anything. Sometimes, and this is a good one for people who are out of town, just to give a call on a regular basis or every now and then. We want to hear from people. We want to know that there's a world out there still. The other big thing is inclusion in life events. Oh my gosh, technology has been great. But it's okay to ask for Zoom meetings or FaceTime weddings or FaceTime funerals. Or our son is an actor, and I've asked the theater for recordings of his show because my cousin can't travel to get there. Sometimes I get them, sometimes I don't. But for private use, taking pictures, and I've asked people to also take pictures when they're with him and I'm not, so that I can look at them and it gives us something to talk about. So there are a lot of very specific things to ask for, things around the house. I really need somebody to sweep my deck and just be specific.
Yeah, don't be afraid to ask. That's great. So can we look at the next slide with some tips and tricks about how to do this? You mentioned some of them, and I just said, don't be afraid to ask. And you said it does make people feel good to help. So, really reach out. Do you want to share some of these others, Deb?
Yes, the second one I find very important. Keep that list of people. If they say they want to help, when you first get the diagnosis, when things are happening, or when there's been a hospitalization or something, people are there right away, just because that's the nature of people. But as you go on year after year, month after month, you might forget that those people that said, I'll help. Keep a list. Call them later on. You may not need their help right now, but later on you might need them. And use your helper's unique skills. I have a friend who's a social worker who's always saying, what can I do? What can I do? What can I do? Well, she's a social worker. There was a time when I needed help getting people to come to our house to help home health care and stuff. Oh man, she was great. That's right what she does. And she was the best person to help with that. So think about the skills that your friends have and use them, because it's easier for them because they already have the knowledge. You have to be flexible with the request. I laugh about this when the grocery brands. My husband tends to be very specific. When he wants Raisin Bran, it has to be Kellogg's Raisin Bran. It has to be extra raisins, and it has to be not the cinnamon kind, not the whatever. And I've said, hey, lay off, give people some grace. They got your Raisin Bran, deal with it. People who live far away, this is the thing. Phone calls, um, discussions and books. We have a Canadian friend who his job is to just send interesting emails and clippings and things to my husband, and they can talk about him or go back and forth on texting or whatever. But that's his way of supporting us, which is really fantastic. This next one, be ready with answers for well-meaning people. Oh my goodness. Okay, the one we hate the most, and you may have had this too, is, wow, he looks so good. He doesn't look sick. Well, he feels like crap. So my answer to that one is, well, looks can be deceiving. And then there are all those people that say, try this diet, try this supplement, try this. Have you done this? Have you done that? My answer to that one is, thank you. I'll mention it to his doctor. And hopefully that shuts him down. If it doesn't shut him down, then I go in for the deeper, but we'll talk about that another time maybe. Concrete needs, you never know what you're going to need, and you never know what somebody has. Like I say, the shower chair there. Realtors, oh my gosh, stair lifts. I found out that when realtors are selling homes and people have to get stuff out of the house to sell it, they ditch, often throw away things like stair lifts and grab bars, things that the chances are they'll give them to you. And then Goodwill, churches, all the other things. Our church has sort of a lending library, if you will, of medical devices and things that anybody can use. I've used a wheelchair there from time to time. Goodwill, I went there when I needed something around, what was it? Oh, that's where I went looking for a walker, and they had about 20 of them, all $5 a piece. So don't think you have to buy everything new, because you're going to have a lot of expenses with this disease. So
Thank you, Deb. That's a great tip. And let's look at some of the resources for some of the practical support that you might need. Caring Bridge is a great website. I know, Deb, you said you'd used that one. You can really communicate a lot about your situation and what you need, and it's a good way to sort of organize support around what's going on for your family. Lots of Helping Hands is also a really good one, especially for meals. If you're trying to organize meals, if you're just getting out of the hospital and you want to set up a meal train, it's perfect for that.
Lots of Helping Hands. That's a new one that I just found out recently. It is better than just meals. You can put tasks in there. And I'll give you an example. I was going to talk about this later, but I just had my knee replaced and I can't drive. So you can, and I have to go to PT twice a week. So I could put in there PT 10:30 to 11:30 on Tuesday, PT this day, and people just sign up. So it's for anything. You need somebody to come over and help you on Wednesday at 3 o'clock with your laundry. It's specific enough. And so it's everything.
That's great. And I think using those kinds of things can really be helpful because it takes the burden of organizing off of you, and you're not having to call and tell every different person every different thing. You can just say, hey, go to here, and you'll figure out what to do for us.
And all those people that said, what can I do to help? Remember that list I told you about on the last slide? Their names go on lots of Helping Hands.
Yeah, absolutely. Caring Village is a similar kind of website you can check out. Postagram is, Deb told me about this one. You can take pictures and send that picture as a postcard to your loved one. So if you're far from your loved one, or if you want to tell family members who might be far from you, ways to cheer them up, that's a great thing. And then here's an article that you can access. And again, all these slides are accessible later, but you can take a look at this article about how to ask for help. It just gives you some tips and some language to use if you're nervous to put yourself out there.
One other thing that I'm going to throw out there is that don't limit yourself to things about the disease. There are so many organizations out there for older adults or people with disabilities that will help you too. I ended up going to, I just heard about this thing at the library yesterday and went, and it was a whole kind of caregiver fair with a panel discussion and tons of things that I learned that I had no idea all this stuff was even available. And they gave me, I thought I had it right here, a magazine that's filled with ideas and resources and so many things that I hadn't. So keep an eye out for libraries, churches, different organizations that might do support group kinds of things, but not just for amyloidosis, things that for any kind of disability, they might be able to help you too.
That's such a good point. You can tap into that network because, like I said at the beginning, 53 million people are living with some form of, caregiving needs. And so there's lots of little things out there that you can find that may apply to you more than you think. So let's move on to the medical aspects of caregiving. And, really you need to be your own advocate. And Debra has some great ideas about this. So let's hear about your go bag.
Well, there's my go bag, or one of them. The first thing I did right off the bat was I packed my medical go bag, and it's something that everything's there all the time. I don't have to think about it when we have to race to the hospital or to anything. I just pick it up and go. Now, for some people, for some women especially, this is their purse, but not for me, because I don't keep a little sweater or blanket in my purse. Chargers, medications, knitting and puzzle, something to do, books, magazines, notebook and pen. I keep I keep journals. All right, get ready for this. These are my journals. 1, 2, 3, 4. In 6 years, that's how many journals I have filled. But those journals are not just for me. Those every time we go to a doctor's appointment, I open my book, and I prefer to do it on a journal. Some people like to do it on their phone or website or computer, whatever. But I just put, I know you can't see that, but it's just handwritten notes, the date, the doctor, and their specialty, and ask them how to spell their name. It's okay. Location. I don't know about you, but we are going to so many different hospitals and clinics. Questions to ask in advance. And then I take notes on the discussions that we've had, making sure that I've checked off all my questions that I've asked. And then at the very end, I ask them for a recap. As we're doing the discussion, I'll circle things that I have to do next. And I'll say, okay, this is what I heard you say, and this is what we have to do next. And then I throw in a little pocket for business cards. I try to grab a business card from every doctor, because I don't know about you, but we have a lot of them. And that helps just to keep everything organized. But I haven't had a single doctor who said, oh, you're taking up too much time. No, they want to recap. They want to make sure you understand what you have to do and what they say. So take notes, use those journals. And even though we all have charts, and EMR, electronic medical records and things, doctors cannot always access them as quickly as sometimes you can access your own notes. When they say, when did this happen, or who did you see for that? They'd have to stop and search through things, and you might have it right there. Going back to the left side of the slide, we keep an overnight bag ready, because there have been times when I've had to race into the hospital, and I don't know if they're going to keep them or not, but they might. And that has, again, chargers, pajamas, clean sets of underwear, the usual stuff for an overnight stay in the hospital. Just so that when we're there, he can feel as, if they do admit him, he can feel as comfortable as we can. And then at home, we have a clinic closet or area. It's got all the medical supplies in it. It's got all the pills and charts, and I've often take pictures of the pills so I can see what it really looks like if I'm not sure what something is and it's not in the bottle, because sometimes they're in just the little pill things that you use, which are great to use, by the way. But then when you fill them, and then the doctor says, oh, you don't need to take the XYZ anymore. You have to go take it out. You have to know what it looks like to take it out. So those are just some of the things that I've learned over the years.
Yeah, that's great advice for how to, help manage the medical care for your loved one. Our next slide will show that it's equally important to manage your own medical care. Please don't forget about yourself, right, Deb?
Oh my goodness. Okay. I have a friend who hadn't been to the dentist in years because she was so busy taking care of her husband until it got so bad that she had to have a root canal. And now she's in bad shape. I have another friend who put off going to the dermatologist because she was just too busy with her husband. And guess what? Now it's skin cancer. Do not forget to take care of yourself. Figure it out. On that, lots of helping hands. You find somebody to come stay with your person if you need to, but you get yourself there. For me, it was, as I mentioned earlier, a knee replacement. I've needed this for quite some time, and finally I just bit the bullet and said, I've got to get this done. But then I had to set up care for me as well as my husband and, figure out all those logistics. But, you just do what you have to do. But
Yeah, you can't take care of other people if you're, struggling yourself. So it is important. And there's some tips and tricks, but we covered a lot of these. Don't be afraid to ask questions, write down your questions, write down the answers. Like Deb had said, bring lists and copies of your stuff because sometimes they can't find it on their computer. And what about this last one, Deb? Learn what you can do, what care you can do, and what you don't want to do.
I've learned to do things that never in my life that I think I would be able to do. And there are some things that I'm okay with doing, and there are some things I'm not. And a simple one is when Peter's in the hospital, he wants me to give him a shower. It's embarrassing. I understand all that, but you know what? Using their equipment and their showers, no. The staff at the hospital is much better at doing things in a way that won't hurt him and is best for him. So just be brave and courageous and do what you can. But then if there are some things that you simply don't want to do or you just can't do, say no. It's all right. Find somebody else to do it, and the professionals can do it. If you can't change a catheter or you can't open a port or you can't do whatever, there are people out there who can come to your house and do it, or you can take your loved one there. Yeah. Medication. I have to tell you about medication. We were at the ER one time, and my husband had a terrific headache, just awful. And they wouldn't give him anything. We had to sit in that waiting room for 4 hours with nothing. Now I keep Tylenol in my go bag, so I can give it to him at the hospital, because the hospital will not give you, at least ours won't give you anything, but I can give him Tylenol, and that helps. That's in my go bag now too.
Perfect. And so some resources, there's a bunch of articles about how to manage medications and coordinate care, questions that you might want to ask if you're considering hiring home health care, and how to do a home safety checklist, for looking around your house for things that you might, if your loved one is in a wheelchair or has some other ambulatory issues that would help you set up your house for that. Also a caregiver logbook that gives you a framework for keeping your notes if you need some help with that organization. And MediSafe has a digital health platform where you can keep all kinds of info about medications and care stuff. So those are some things to check out. And now we'll move into the legal and financial aspects of caregiving. And the question here, the main watchword here is to be prepared. It's really important to have all your ducks in a row. So let's take a look at some of that. I think that, here is a good list of documents that you need to manage your finances and also the medical care piece. Do you want to share a little bit about that, Deb?
I want to talk to you as the wife of an oncologist with people who do not survive. And the stories he told me, of course, HIPAA, he doesn't mention names, but he'll have somebody who he's caring for, and he knows their days are numbered, and he will, and the family and the patient refuse to talk about anything. So nobody knows what your loved one wants to do. They can only assume. So my thing, and I learned this from my husband, is you let your loved ones know what you want, and you put it in writing. There are forms you can get from the hospital, online, wherever. I'm sure amyloidosis probably has some too. Get things in writing so you know what your loved one wants to do. Then when it's time for you to decide, do you put them on a ventilator? Do you do this? Do you do that? Do you do this? Do you do that? You're not making a decision. You are executing their wishes. And that is a huge relief. I'm not doing what I want to do. I'm doing what he wants to be done with his life. So get your ducks in a row. The other thing I will tell you about that area is that this is especially important for people who may not have legal status through a marriage or legal partnership or anything. You can be the one taking care of your loved one. But when something important has to be decided, the doctors will refer to the next of kin or somebody who may be in an old document. My husband's told me about people who are dying of cancer, and some relative swoops in from California and says, this is what I want done. And they haven't even seen the patient in months or years, but they have the legal right to make the decisions about the person that you've been caring for years or months or whatever. So I cannot stress this enough. Get your legal documents together. And I'm not going to go through this entire checklist, but it's there for you. Take a look at it. Make sure you understand things. Put things in your own name. Because, oh my gosh, I tried to do something with Verizon, just, the phone company. And they wouldn't talk to me because the account was in his name. And he wasn't in a position at the time to even talk to anybody. He couldn't cognitively think about what it was that I needed. So get things in your own name. Insurance policies, make sure they're up to date. What else can I say about this? It's just so important.
It's really important. It's stressful and somewhat boring and confusing too, but it's important. So some tips and tricks on our next slide. We've talked about them mostly. Upload the documents and keep a copy in your medical bag. If you have decisions about your medical care, you want to have a copy to hand people in the hospital. Change accounts to your name. You just talked about that. And have discussions about this kind of stuff. It's hard to broach the topic, but do it because it makes things easier later. And don't do it alone. There's lots of resources out there for you. And in fact, on the next slide, I can share some of those resources.
I want to jump in here on that one. And that last thing is truly do not do it alone. Yeah. This is a whole new world that nobody could ever in their right mind expect to know all the ins and outs and the details of what's going on. You just can't know it. I don't care how smart you are. So get help. There are navigators at hospitals. There are legal representations. There are all kinds of things. And again, many of them are free. You don't always have to pay out of pocket for everything, but get good advice, not just from your friend next door, but from professionals.
Absolutely. Yeah. And to do that, you can look at some of these lists of documents that you might need to prepare. The Institute on Aging has a good worksheet. Knockbox is this interesting thing where you can get a box that has files for every important document. It has lists of all the stuff you would ever want to have financially and legally for your loved one and yourself. And it's a good way to get yourself organized. And then moving into the financial assistance piece as well, because I know that's a really big issue for people. There is a National Family Caregiver Support Program where you can get some funding for your caregiving needs. NORD has a caregiver respite fund where you can get some money to help you if you need a break and to get someone to take care of your loved one. And the VA has a great caregiver support program too. So there are financial resources out there. There are legal advice resources out there. And we really do encourage you to look into that early.
One other thing I was just left off the list because I was looking at it is AARP. Oh my goodness, they have so much. I just got their monthly newsletter thing. and they have so many resources that are easily accessible, and many of us already belong to AARP, so use it.
Yeah, perfect. So let's go into our last and maybe biggest category to talk about here, which is the emotional aspects of caregiving. And with diagnosis, your life has changed. You talked a little about that at the beginning, Deb, but let's hear this next quote from you. With diagnosis, your life has changed. You share the disease. You are in this together. There goes your travel, your hobbies, your plans in some cases. Your days are at the doctor's, tests, symptoms, that's what fills your life. So what do? You still have a life and you must live it. So tell us how you do that, Deb. Yeah, in a nutshell.
Oh, thank you. Sometimes not very well. One of the first things is just accepting it. Acceptance is really hard. When my husband was diagnosed and had to retire from his medical practice, I did too. I had been doing consulting. I had been retired, but I had been doing some consulting work, and I just couldn't do that anymore. I couldn't get on an airplane and go, manage a film shoot or whatever. So acceptance probably should be first, but and then you have to manage expectations, because they change by the hour. You think something's going to be fine, and then you find that, oh no, he can't do it, or he can't do that, or oh, we're in the ER instead of being at that dinner we said we'd go to. So you just have to deal with it. Pride and dignity. This is a big one. And because I think of the emotional aspects for me, but also for my husband, my goodness, he has so much that he has to deal with. One of the things that it's kind of weird is people don't talk to him directly sometimes. They talk to me, or they'll call me, how's he doing? Or they'll text me, how's he doing? Call him. He wants to hear from you. He wants to know. He's still a real person, and he can talk to you. So I try, even in doctor's appointments, to let him talk. Now, there are things that he might forget, or because I have the list in my little journal, I'll remember things. So it's a shared experience, and it's gonna be normal to feel grief. I can't tell you how many times I've cried over the life that we don't have, the life that we thought we were going to have. It's not there anymore, and it never will be. It's different, and it's a grieving process even now. Counseling, yeah, get somebody to help you, for them and for you. Professional help can be a lifesaver. It can be wonderful. Navigating conflict. Oh my gosh. There was a time when my husband had a seizure and he wasn't able to drive. He thought he could drive. Finally, his doctor said, no. If you get in an accident, if something happens, I will not back you up. Legally, you are on your own. And it wasn't me, it was the doctor. And then my husband had COVID for the first time after all these years, just recently. And everything that he had going on, COVID just exacerbated it. And he thought he was fine. He thought he could drive. He thought he could do all kinds of things. And I had to go behind his back and talk to his doctor and say, I kept a chart. This is what he said. This is what just different things that were not quite right. And again, it's the disease. And in this case, like I said, exacerbated by COVID. But it was his doctor's. It said, I want you to go get a driving test. And until you have that piece of paper in my hand that says that you're safe to drive, I will not sign off. And he did. And they gave him the written test, the vision test, and the driving test, and he passed them all. So, okay, now he can drive. And I'm okay with that. It was for my peace of mind too. But we've had some conflict about things. Again, during COVID, he fell actually one weekend 3 times, and And there was only so much I could do to get him up. I called the neighbor one time to help me. The second time, it was the middle of the night, and I couldn't. I just couldn't. I called 911, and he has always said, no, 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 I don't. And, but I did it anyway. And we spent 12 hours in the emergency room with all kinds of tests and all that kind of stuff. Finally went home. Just recently, he got a statement from the ambulance company asking about insurance. He said, what's this all about? And I said, from when you went to the emergency room. I didn't go in an ambulance. I said, yeah, you did. No, I didn't. Yes, you did. And I remember the conflict we had, the almost fighting. I'm calling them. I don't care what you say. But I did it anyway. And doesn't even remember. Go figure. I don't know. It's hard. Coping with burnout. Oh my gosh. Oh, so many times I just want to say I can't do this anymore. It's real. You have to get those breaks. You have to take care of yourself. And I've lost it a couple times. One time I was with I'm in a women's group, and there were about 12 of us sitting around, and they were talking about all these things that they were doing and going places they were going and all this. And I just lost it. I can't do any of that stuff. And rather than questioning me, they supported me. They said, well, it's about time you blew up. We've been waiting for that. It's okay. So don't think you're a bad person just because you blow up and you get burned out. Find somebody to talk to, friends, professionals, whatever, and know that is normal. And then the final thing over on the right, I get so tired of people saying thoughts and prayers, thoughts and prayers, thoughts and prayers. A very smart theologian once told me, when there's nothing else to do, accept those thoughts and prayers. When people don't know what to do and they want to help you, but there's nothing they can do, each one of those thoughts and prayers is a way of saying, I love you. Keep that in mind.
That's great. Thank you. Let's look at some of the tips that we've already, covered some. Talk to someone. Be careful what you commit to, but stay involved. So there's that balancing act.
Yes, let me do that. Everybody knows that my life could change in a heartbeat. So I am very careful what I commit to. And I try very hard to commit to, because I want to stay involved. But I always have a plan B. There's usually somebody else who can take over and make sure that when you're doing a project or volunteer work, you take those notes, you keep that binder, whatever it is, your project, so you can turn it over to somebody else in a moment. And I call myself a professional volunteer, not just here at home, but I'm involved in all kinds of volunteer activities around town because I can't travel. I can't leave, our greater Cincinnati area very much, but there's so much I can do and still stay involved. So you do what you can, then you let it go. I was involved in some committees that I was supposed to do things, and I just called people and said, I can't do this anymore. Got to go. Massage. Somebody wants to give you a present. How about a gift certificate for a massage or a manicure or something? Meditation, exercise. People talk about exercise. Well, because it works. Oh, let me tell you about exercise a minute too. My husband has a hard time walking. We live on a hill. Look for places to walk that are easy for him and for you. Okay, shopping malls. They're flat. They're climate controlled. You can walk to your heart's desire. Go to the grocery store. He has a cart to hold on to. The problem with that one is he comes home with a bus. But art museums. We have an art museum up the road that's fabulous. Walk to your heart's content. It's flat. It's not too hot. It's not too cold. And it gets you out of the frickin' house. And museums are great because you can stop and take a break. They usually have chairs to sit on or whatever, but they're flat. And climate control is a big deal. You know, your person may not be able to walk in the snow and the rain, but they can walk someplace else. And then the last thing on here, just be honest with yourself. You're not, everything's not going to be rose. Don't be Pollyanna. That's not life.
Yeah, that's so true. And, hearkening back to what you said about the museums and stuff, that goes up to the top where I said, find things to do together, because you want to be able to do some activities that aren't all around the caring part. That's not, just the medical appointments. You're still his wife. You're not his mother, maid, nurse. You want to be in that role. So, as much as you can, find things for yourself for a break, but also find enjoyable activities that you can share.
Mhm.
And here's some resources. The first one is ARC Support Services. We're here for you if you want to talk about any of the emotional or practical aspects of caregiving. There's a support group for caregivers Facebook page through Amyloidosis support groups. Here's some great articles from Cleveland Clinic and Mayo Clinic about tips for how to care for yourself. Some ideas for knowing when it's depression. When does your stress cross into that depression and anxiety that you really need to get professional treatment for? And if you do find that you're in that place, how you can find a therapist, and of course the crisis line. The statistic says that 40 to 70% of caregivers suffer with depression. That's a big percentage. And even more than that suffer with burnout, stress, and those early signs of mental health issues. So please get help if you need it, and we're here. Reach out anytime. So moving along, what keeps us going as caregivers? What keeps you going, Deb?
First off, I love this man. And I have to keep thinking of the man that I married, not the man that he is right now. We all change, we all grow, we evolve. But when you have a disease, everything changes. And usually not for the better, but sometimes. I love him. I stood at an altar and said, I do, and I'm still doing, and I will do as long as I can. Now, we're in a husband and wife relationship, but if I was a caregiver and it's my mom or a friend, you do those things because it's kind of part of who you are and who you want to be the kind of person that has compassion and the ability to care for somebody else. It's not always fun, but you do it because that's you do. We're human, and I love this man. So that's what keeps me going, and it's kind of hard sometimes, but it's what it is.
Thank you for sharing. I want to move into this general caregiving resources again. Just remember, these slides are available later, so you can check out all these resources for yourself. But these are some good places to go for practical help, for support, both emotional and financial and practical help that you might need. And then just on an ending note, kind of going along with what Debra was saying about the love that she has for Peter, there are some strengths that come out of caregiving. It's a hard road, and I'm not trying to minimize that, but there are some real strengths that can come. And one of those can be a closer relationship, which is important to keep in mind. There's days that it won't feel as close, but there's days that it could be closer. Also, you could find a network that you didn't even know you had of friends and family and professionals and people in your community that can really reach out and help in a way that you weren't aware they were there. It's really special to see who comes out of the woodwork for you. Sometimes people you think are going to be there are not, and other people that you never thought do step up, and that's really kind of special to see. Another strength that can come out of it is confidence, right? And being able to speak up. Sometimes people are able to advocate for their loved one in a way that they can't for themselves. So having a voice, having that strength and confidence. And then I'd say the final strength, or, one of the others is faith. Some people's faith can be tested, but sometimes it deepens. And it really puts into focus what matters, what's important, what actually matters in life. And so I think keeping that hope alive, keeping those strengths in perspective can help you on those really tough days. So I just want to give a special shout out to Deb for sharing all this with us. I know it's a hard topic to delve into, and you've given us some great things to think about. We have a few minutes here for some questions, if anybody has anything that they'd like to share in the Q&A.
Thank you so much, Ann and Deb. We appreciate your sharing all this information today. We do have a couple of questions. And actually, someone wanted to know sort of how do you know when stress really becomes something that you need to get help for or treatment? Kind of when does it cross into depression?
Yeah, that's a great question. So there are some red flags to be aware of. One is unexplained aches and pains. If you have some, if you're in pain and having some physical symptoms that you don't know what they're coming from, that can actually be a sign of depression. Also, changes in appetite, either more or less, which then, corresponds often with a loss of weight or a gain of weight, can be a red flag. Certainly, if you're having trouble sleeping or sleeping too much, both of those can be a sign of depression on one end or the other. If you're having trouble concentrating, that can be a sign. And then general irritability, moodiness, these are sort of issues of degree, right? So we all have all of these things all of the time. And I think that it's important to know that there's going to be some stress, there's going to be some sleepless nights. But if you're finding over time that it's getting worse, that it's consistent, that you're moodier and irritable for no good reason frequently, those are signs of depression. So it doesn't ever hurt to get a screening, to talk to your primary care physician, or to reach out to some helpline or therapist, to find some support that you need.
Thank you, Ann. We did have one person that said, I heard a tip once about caregiving. You need to find 15 minutes each day to get outside and do something solo. It can be 5 minutes here or there. So I thought that was, Deb, if you want to comment on that, I thought it was a great tip.
Yeah, I can't say enough about just spending some time doing what you like to do, or being outside. For me, just being outside and sitting on the patio, or when somebody comes over, sometimes I'll say, let's sit outside or let's take a walk. If people want to visit, it doesn't mean they have to come and sit in your living room. Go take a walk with them or yourself.
And we are having a couple of questions about whether the talk will be available later. It is. We will have it on the website, and we'll also have the slides posted. So you'll be able to get all the links. You'll be able to get the QR code for our survey. All those things will be available. And someone else had asked about, are there support groups that meet virtually? They heard you mention this Facebook groups, but if you have any information about where they could maybe check that out, that would be helpful.
Yeah, there are some. I mean, on the amyloidosis support group website, they list different virtual support groups that meet around the country. And often those are for caregivers as well as patients. But also external to amyloidosis, there are lots of support groups, often at your local hospital, maybe your local church or community center, where they're just more general support for caregiver groups. And I think, the issues are the same. As Deb said in the beginning, you can be in a cancer support group, you can be in a, people with disability caregiving support group, and a lot of the emotional pieces are the same. So look around your community for that kind of thing, both in person and virtual. And if you're having trouble finding one, you can always reach out to ARC and we'll help link you up.
Great. Thanks, Ann. Deb, given what you've learned throughout the years, what advice would you give the Deb of 2018? When she was just starting out. What advice would you give?
Oh my. Flexibility, truly understanding that this is a journey and you don't know the ending. Maybe I would have taken better care of myself then, because I really, at the beginning, you just go straight to your loved one and anything they want, that's what you're doing. And it took me a while to ask for help. Go ahead, ask for help right away. Don't wait. There are a few things I did right. We happened to have been building a house when he was diagnosed. And I say happened, our retirement house, we were downsizing. And I went ahead and put in the grab bars and I put in the elevator, which is a huge issue, I know, but we were able to do it. So I'm glad I did think ahead. I I thought ahead for what is coming, not for what is. And that is something I did do. But did I have all the answers? No, I didn't. But I also never would have realized that people were so enveloping with love. You mentioned it earlier, Anne. People that you didn't know would come forward came out of the woodwork to help. People that I thought I could depend on weren't there, but it's okay. I learned about the circle of love that is here for both of us. And I had no clue it would be that big. No clue.
Learn a lot as you go, I'm sure. So thanks, Deb. And I think this might be our last question here. Maybe we have a little more time, but someone was asking, what do you do when relatives don't agree about how to care for your loved one? So either you or Deb on this as well, but Anne, just maybe from your experience as a social worker, and Deb, if you'd like to comment on that as well.
Well, start with the legal issues. I'm the medical power of attorney, and that's what we're going to do. And if you don't have that, then I'm going to turf it to you, Anne.
I mean, I think it kind of comes down to talking, being open and honest with each other, sitting down and having a conversation. And if you can't do that with your relatives, sometimes you might want to look into getting counseling or mediation around that issue. Hiring a professional care manager can be helpful if you're able to do that. And there is some funding available if that's beyond your means. But sometimes those professional care managers can sort of help navigate the differences in opinion among family members and kind of come to a consensus. And again, getting the patient's wishes in writing, and as much as possible, have the patient speak up for what they want. That goes a long way to kind of smoothing over some of these concerns.
Deb, anything else?
And look to the professionals. I might have an opinion. Somebody else might have an opinion. The doctor is the one that matters.
Right.
Right. Absolutely. I think that we are through with our questions for today. And I wanted to take this opportunity again to thank Deb and to thank Anne for being with us today and sharing your information. I know this is a topic that a lot of people want more information on. And so it was very helpful, Deb, to hear your perspectives and what you've gone through. And we certainly do appreciate it. And Anne, thanks again for your help as well. Just one last reminder that this information will be available on our website, so you'll be able to see the recording as well as any of the PowerPoints and other information that we might log there. So thank you so much for joining us, and we look forward to having you join us for next month's webinar. Have a good afternoon.
And then if you're in my area, give me a call. We'll have coffee.
Thank you. Thanks so much, Deb. All right. Well, take care.
All right. Thank you.
Bye.